Okay, Linda Clement. Yes, Linda?
I'd rather read a different one if I may.
You may ask anything you'd like.
I want to thank you for coming.
Thank you for being here.
And I had something else to say after that.
Take a minute. Give her a minute.
A few days ago, I heard a congressman say that he doesn't care if the majority is against the bill. And he doesn't care if he's not reelected. I heard that. Because he and others in Congress know what's best for all of us. That's why we feel our voice is not being heard. So these points, tort reform has not been mentioned. As Medicare is in trouble financially, but yet we're trying to add more people to maybe a different kind of role. CBO says that the bill that's out there is going to increase costs instead of decrease.
That's not the bill we're considering in the Senate.
I know it's not the Senate bill. I feel like Congress owes so many favors to so many supporters that it hinders our country from getting a reasonable, nonpartisan bill. So my question is, why is Congress trying to pass such a complicated, all-encompassing bill so fast?
Well, I don't know about you guys. No, that was like 4. You gotta be like, we have 4. Let me do that. Y'all at least got 2, okay? You don't want us to do it fast and tort reform, okay? Let me do those 2. First of all, I gotta tell you the truth. I can't remember an election when I didn't watch somebody running for office on TV talking about working on healthcare reform. I can't remember one. I can't remember ever going around the state and talking about anything when somebody didn't raise their hand, like this woman, and chew on me about how ridiculously out of control they felt in terms of controlling their healthcare needs. This is something that's been talked about for a long, long time. Are we moving quickly? No, we're not moving quickly. We don't even have a bill out of the Finance Committee. We don't even have a bill out of the Finance Committee. And I think the fact that we don't is because many of us said it's better that we slow down and go home and listen than try to rush through and pass something before we go home and listen. And I will make a prediction to you. I don't think it's going to go fast when we get back. There are lots of different opinions here. There are lots of different ideas. There are lots of strong opinions. There's a lot of money pushing for us to do nothing. A lot of money pushing for us to do nothing. So, I don't think it will go fast. Now, tort reform. Let me tell you that, how many lawyers do we have in the room? Nobody wants to admit it. All right. Okay, let me just tell you that 99% of all medical malpractice lawsuits are filed at the state level. It's not the case that you generally, in very limited circumstances, would you have the ability to take a medical malpractice case to a federal court. So states have the ability to control medical malpractice, and they have in many states. Missouri is an example. There was a very aggressive tort reform done in Missouri in 2005, okay? And the number of, in fact, malpractice claims are at a historic low in this state right now because of the tort reform that was done. During the same period of time, those malpractice claims have gone down. Healthcare costs have gone up by 200%. Texas, same thing. Very aggressive tort reform. Florida, one of the highest increases in healthcare costs in the country. They have incredibly aggressive tort reform. California, same thing. So what I'm saying to you is, if tort reform were the magic bullet, you would have seen your healthcare costs go down in Missouri.
I just think it should be harder.
Well, believe me, it's just being discussed and debated, and there'll be amendments, and they'll be voted on. It's not as if it's not being discussed. But I will tell you, there is documentation that doctors' malpractice rates go down. They pay less for malpractice insurance with tort reform. But that has not transferred into lower healthcare costs for folks. It has not happened. So I'm not sure that that's going to be the magic pill.